Hello and welcome to my third presentation of 2023 for Project Hope Horse Welfare. Today we're going to talk about managing the elder horse. There is a lot to cover, so I suggest you have your phone ready or your screenshot button ready to take photos of the slides so that you can go back and look at them. Here we go. So the first question to ask, how old is an elder or senior horse? Overall, horses seem to experience a general reduction in vigour after the age of 15. Some horses may show signs of reduced vigour earlier if they have had compromise earlier in life. This is particularly the case for horses that have not had good parasite management, adequate nutrition, experienced obesity, or have had a vigorous athletic career. There seems to be some genetically linked problems in terms of metabolic disease, and foals born of fat mamas will often develop insulin dysregulation and even equine metabolic disease. This picture is two of my darling oldies. Drama is the dun on the left. She is 19 and Teddy is 17. Teddy suffered a check ligament rupture 2 years ago. Spot on what the textbooks predict, while Drama has battled EMS all her life. She has recently had 2 molars removed and a filling placed in a third. Both are displaying very similar age-related changes, including loss of top line and failure to thrive on what was previously adequate diet. There is no single age point that a horse can be defined as an elder. Many horses do not develop signs of old age until much later than 15. That said, it is important that you monitor your horses from their mid to late teens, as changes will indicate that they are starting to need more care that matches their developing old age changes. On this slide, we have a graph showing the most common causes of death in older horses. Although performed in the UK, we can assume our horses here in Australia are experiencing a similar distribution of disease. When I was back in vet school, I was told that old horses die of colic. This research seems to support this statement. The tendency for horses to develop gastrointestinal, endocrine and musculoskeletal problems as they age represent a management challenge to those who care for them. Older horses will often have a variety of problems going on at the same time. Indeed, many of the problems faced by older horses will not be fatal, but they do have a detrimental impact on the horse's quality of life. It is up to us as responsible horse owners to do all we can to minimise the impact these ravages of age can have on our horses. The first important issue I want to cover is dental disease, as it is very common in older horses and often overlooked. Dental problems are at the root of many of older horses' health problems, from gut dysfunction to heart valve disease. Horses do not stop eating if they have dental pain. They will keep eating even if they have broken jaws. If you notice that your horse has stopped eating, it is very sick and needs immediate veterinary attention. Dental problems, instead, will usually present far more subtly, such as looser manure or more tongue work while eating, as the horse tries to maneuver the food bolus into a less painful tooth combination. Spend time watching your horse chewing. Is it rhythmical, with an equal excursion of the lower jaw on both sides? If not, the horse needs to have a dental examination. Quitting or dropping food while the horse eats or any unusual behaviours while eating, such as twisting the head to one side, moving the tongue inside the cheeks or outside the mouth, or rubbing the gums on the bucket can be an indication there is an underlying dental problem. Tooth wear and tooth loss results in a lower curve of spee. I can't tell you how pleased I am to get that phrase into this presentation. A lower curve of spee reduces the biomechanical efficiency of the horse's jaws. Ideally, management of horses' teeth occurs all through their life, and the effectiveness of good lifelong dental management is the best guarantee that the horse will have better dental health as it gets older. Good dental management is not simply rasping off the occlusal surface. Modern equine dentistry is designed to preserve tooth height and health for as long as possible. That said, it is almost inevitable that horses will begin to have major dental problems in their late teens. Such deterioration means that we must be prepared to change our management strategies, particularly in the area of how and when we feed our elderly horses. I've put this slide in at the last minute in response to a question from Madeleine Ellis. Thanks, Madeleine, as I had not included this topic initially. Madeleine was concerned about the effect of sedation and anaesthetics on older horses. I am relying on the work of Reza Sedeghi and Thomas Doherty to answer this question. There is no doubt that older horses are more sensitive and vulnerable to the effects of sedating and anaesthetic agents. Some of the agents do drop blood pressure, so your veterinarian may prefer you to go to a specialist centre where there can be supportive oxygen available and also well-designed padded recovery stalls in the event that a general anaesthetic is required. That said, many procedures can and will be carried out on elderly patients with the standing sedations. Sedeghi and Doherty actually recommend standing sedation be the preferred approach for older patients. Although acepromazine should be avoided as it does profoundly reduce blood pressure, smaller doses of the safer alpha-2 agonists such as xylazine can produce a profound sedation and analgesia. They should be administered slowly and to effect. The sedated horse's temperature should be monitored during the process, especially if it suffers anhidrosis or has reduced muscle mass. There is some indication that horses with stiff artery walls, which is a cardiovascular problem in older horses, may be more likely to experience ruptures of these arteries after receiving alpha-2 agonists. Certainly, sedation of older horses does require a bit more caution in that the horses tend to be more susceptible to the effects of the drugs, perhaps due to hepatic function or just less muscle mass. Regardless, sedation is absolutely necessary as it would be unethical and dangerous to carry out pain-inducing procedures without appropriate sedation, anaesthetic and pain management. Given dental deterioration is almost ubiquitous in older horses, we need to consider how teeth wear determines what form of feed we are to provide these horses. Horses that have lost or worn down incisors can still eat hay, and that is a good thing as long stem forage is an ideal type of roughage for the hindgut. Worn or missing molars, however, is a far bigger problem. The horse still needs 2% roughage to maintain gut health in a form the gut flora can use. Essentially, you are using processed foods to be ready to swallow. Do remember to look at food miles when you select your roughage. For example, sugar beet is all imported at the moment, although sugar beet has been reintroduced commercially into New Zealand, and I noticed there was a recent Nuffield scholarship study on reintroducing beets to Australia. Watch this space. Do not feed unprocessed grains to horses with dental impairment. Not only is it a waste of money, but it can lead to impaction and fermentation colics. Remember, oil is a good way to get calories into horses without requiring any mastication. It also is a way to provide omega-3 fatty acids. In addition to dental disease, the hindgut of the horse appears to lose some abilities to ferment fibre, probably due to changing populations of bacteria in the hindgut microbiome arising from dental changes, leading to an inability to present forage to the hindgut in an ideal form. This means you will have to change how you provide roughage to your elder horses. Prebiotics are increasingly being added to premix feeds. They start the fermentation process of roughage. Unfortunately, some older horses will also experience impairment in their small intestine function. You will recall that the small intestine is where simple carbohydrates like sugar and fructose is absorbed. It is also where proteins are often absorbed. If these substances are not absorbed from the small intestine, they will travel through to the hindgut where they will ferment and cause gas, diarrhea, and even worst case scenarios, colic. It is also a waste of money if you are feeding your horse these substances that are designed to be taken up in the small intestine, as they just get pooed out without benefiting the horse. Never feed whole grains to older horses. Grain-based feed must be processed to assist with the digestive process. They can be boiled, extruded, pelleted, micronized or steam flaked. All these processes are designed to make the starch in them easier to digest. The small intestine is also where many vitamins are absorbed. There may be an argument to increase the supply of vitamin C, vitamin E, vitamin B12 in your older horse's diet. If you suspect that the horse is experiencing problems actually breaking down the nutrients in the small intestine, you can add supplements that contain enzymes such as amylase and amyloglucosidase. Some commercial feeds designed for older horses do already contain these enzymes. Protein levels are important. It is worth spending the extra on the higher quality of feeds. You should be looking for feeds that have contain 16 to 20% protein. If dental disease determines how we present the feed, gut function determines what to feed. This means that you will have to experiment in the type and presentation of foodstuffs. Soaking feeds to soften and start the digestive process is a valid practice, but be aware that soaking for too long also leaches some of the vitamins and minerals from the feed. One of the major changes in feeding practices that you might have to consider is the addition of oils or fats to your horse's diet. Horses with access and the ability to eat good green pasture will obtain most of their essential fatty acids from pasture. This is not the case with elder horses or horses that must rely on hay or hay equivalents for their forage, or for horses whose dental health precludes adequately obtaining or digesting the grass. Omega fatty acids come in several chain lengths, 3, 6 and 9. Confusingly, omega-3 fatty acids are believed to reduce inflammation, while omega-6 fatty acids play an important role in inducing inflammation. The latter is a major part for fighting infections and incredibly important. That said, an imbalance between 3 and 6 omega fatty acids can produce more inflammation than necessary in the horse's body. Most commercially available sources of essential fatty acids contain both 3 and 6 omega fatty acids. Linseed or flaxseed oil, for example, contains a ratio of 4:1, omega-3s to omega-6, which is the same as grass. To add to the confusion, grains contain high levels of omega-6 essential fatty acids, so you need to feed more omega-3s to balance. For those detailed-oriented people, omega-9s are most prevalent in olive oil and canola oil. The good news is that healthy horses, even healthy old horses, can manufacture omega-9 fats in their body. I could not find any evidence that old horses lose this ability. It is important to think about not exceeding 1 ml of oil per kilogram unless directed by nutritionists or the veterinarian. There is plenty of information available on the internet regarding introducing and maintaining horses with oils or fats in their diet. Even though the commercial feeds now available for older horses provide an excellent resource, you need to be aware that some senior feeds are not formulated to be suitable for horses suffering insulin dysregulation, as they still have very high simple sugars. Consult your nutritionist or compare on Feed Excel when designing your horse's rations. Please remember that addition of salt is very important for horses who are undergoing the sweating stage of PPID. This slide contains some tips on how to feed the horses. Do consider pre-soaking or wetting the feed down. Feed smaller and more frequent meals. Consider hay cubes or similar forms of forage if long stem hay cannot be adequately chewed. And please feed your geriatrics separately to the other horses so that they do not have to compete for their food. One of the problems that is seen in older horses is choke. This is where foodstuffs become lodged in the esophagus and the horse is unable to dislodge them. Poor dental function does predispose horses to choke because the food may not be adequately masticated. Past surgery for laryngeal problems that affected the performance, such as tie back or tie forward surgeries, can also contribute to choke incidents. Finally, older horses may have esophageal muscle weakness or even strictures, which make them very vulnerable to choke. Ironically, these strictures are caused by prior incidents of chokes. As older horses may be having difficulty absorbing nutrients from their rations, they can become very hungry, and this can cause them to gulp their food down without chewing properly. It also results in less saliva production. This can be made worse by an underlying low-grade dehydration, as older horses do not always drink enough. Older horses can also be harried by younger herd members and may attempt to rush to eat their ration. Please do observe your horse eating and make sure that you try to prevent incidents of choke. It is very distressing for the horse and just as distressing for the owners and the vets. Old horses do seem to become more vulnerable to parasite infestation as they get older. This seems to be mainly caused by immune function compromise, but there might be also practical considerations such as not grazing on fresher pasture due to immobility. Worming on fecal egg count results is increasingly important for older horses because their gut is so much more vulnerable to parasite damage. The process of drenching or using dewormers can even induce migration of strongyles out of the gut wall. This is painful and can induce colic. Unnecessary drenching is also leading to increased resistance to wormers amongst parasites. You should also monitor for external parasites such as lice, particularly in horses who are long-coated due to endocrine disease, and fungal infections, particularly for those horses that we tend to have to rug more. Insulin dysregulation is extremely common in older horses. It can occur as a result of obesity, both currently but also previously in their life, pituitary pars intermedia disease, and in some cases, genetics. In many ways, insulin resistance is not dissimilar to the problems we see in humans with pre-diabetes and type 2 diabetes. The impact on the horse's body is scarily similar, which is why horses are beginning to be used as a model for treating human metabolic disease. A high proportion of older horses are at risk of developing equine metabolic syndrome. This is associated with a raft of clinical signs and problems. Not the least of these is a process now dubbed inflammaging, which is the low-grade systemic inflammatory response associated with insulin dysregulation. Insulin dysregulation and abnormal fatty deposits seem to be associated with increased inflammatory cytokine production. It is seen in both insulin dysregulation horses and horses suffering PPID. The principal treatment for insulin dysregulation is dietary management and exercise, although more recently several drugs have been investigated and used to reduce the impact of the insulin dysregulation. Some horses continue to be refractory to these pharmaceuticals, and there are a whole raft of drugs being looked at that look positive to manage insulin dysregulation. It is important to remember that insulin dysregulation horses seem to have an apparent threshold for non-structural carbohydrates in their feeds of around 0.1 gram per kilogram body weight per meal. This is not a lot of sugar or starch. You need to keep this in mind when you are developing your feed rations for your horses if they are affected by insulin dysregulation. 1 in 4 horses will develop pituitary pars intermedia dysfunction, or PPID. Although it is most common in horses over the age of 15, it can be found in younger horses. Indeed, there have been cases identified in horses as young as 7, although it is believed that they may be suffering some sort of genetically mediated problem. The equine intermediate part of the pituitary is quite different in function than humans. The development of PPID in horses is not really a tumour, but a result of these functional differences. The pathology actually begins in the hypothalamus, way up in the brain. The hypothalamus stops providing as much dopamine to the pituitary due to damage of the dopaminergic neurons within the hypothalamus. This results in reduced dopamine. Dopamine plays an important role in inhibiting the release of hormones and chemical messages that stimulate other parts of the horse's body. PPID presents with a raft of clinical signs. The most common one, and often the first one noticed, is a tendency to grow a longer winter coat and take longer to shed it at the end of the season. Many PPID horses also show insulin dysregulation, and indeed this is thought to be an indicator of long-term PPID. Horses with PPID are 4 times more likely to have chronic laminitis than age-matched PPID-free horses. Older horses with PPID are more likely to suffer weight loss, and impaired immune function is a big problem in PPID horses. Infections are 3 times more likely in age-matched PPID horses than horses that are free of PPID. Worryingly, horses with PPID are more likely to show faster neurodegeneration and muscle strength, especially in the anti-gravity muscles along the top line and neck. This can make them more likely to trip and fall. PPID positive horses have greater connective tissue deterioration, especially in the suspensory ligaments. Diagnosis of PPID is still tricky, especially in the early stages, and the results of the various available tests are open to interpretation. The treatment options, however, are clear. Paraglide is the only way to go. It does have some unpleasant side effects, particularly during the introductory phases. Fortunately, there are a few very helpful groups and resources on the internet. Horses being tested for PPID should also be tested for insulin resistance, as management practices of both these diseases are different. Horses with PPID often suffer other diseases caused in part by the endocrine dysfunction arising out of the abnormal pituitary stimulus. Sometimes it is these recurring diseases that triggers the suspicion that the horse may indeed be suffering PPID. Please consider it as a diagnosis if your horse is getting recurrent problems such as foot abscesses or is slow to heal from injury. As mentioned earlier, Paraglide remains the mainstay of treating PPID clinical signs. You can also assist your horse with coping with PPID through husbandry practices such as aggressive preventative care, vitamin B12 supplement, clipping long coats, particularly in spring, and ensuring that the horse has a comfortable environment in which to live. Osteoarthritis can, of course, occur in any age of horse. It is now known that 50% of horses older than 15 years will have osteoarthritis, and almost 100% of horses over the age of 30 will have osteoarthritis. Please be aware that by the time lameness is obvious due to osteoarthritis, irreversible cartilage damage in the affected joints has already occurred. Soberingly, 60% of all lamenesses in horses is related to osteoarthritis. Any horse with a conformational fault that interferes with their biomechanics, or any horse that has had an athletic career, will have osteoarthritis to some degree. Certainly good management starts at the start, keeping horses fit under a body condition score of 3.5 and continuously moving will reduce the impact of osteoarthritis, but it will not stop them getting it. Most afflicted horses will require pharmacological support. COX-2 sparing non-steroidal anti-inflammatories are the mainstay of this approach. Be aware that of the plethora of oral supplements available, most do not have any evidence to back their claims of efficacy. Be very clear what you want out of your treatment process. Products such as Pentasan do seem to reduce the macroscopic pathology of the joint, but not the clinical signs of the osteoarthritis. In other words, the joint is in better condition, but the horse is still experiencing pain. Conversely, injection of hyaluronic acid appears to reduce the clinical signs, but does nothing to improve the pathology of the joints. Intra-articular injections with corticosteroids do reduce inflation and pain. They do not do anything to heal the underlying pathology and should be considered an end-stage management strategy. Biologics such as PRP are increasingly being used to manage osteoarthritis signs in athletic animals, but costs may preclude treatment in elder horses. Bodywork, red light therapy, laser therapy, and keeping the horses warm and moving all have roles in helping the horse deal with the discomfort of osteoarthritis. The mainstay will still be anti-inflammatories and increased omega-3 fatty acids. You should be keeping the horse active. It's tricky, but keeping them moving is prioritized over pain, just like us, but be gentle. Although musculoskeletal disease does not generally cause the death of older horses, it can have a significant impact on the quality of life of the horse. It can even contribute to the death of the horse via catastrophic fractures. Connective tissue loses its elasticity as the horse gets older, so elder horses are more prone to injuries in their tendons and ligaments. Warming them up gently and avoiding overstraining these structures is important. Collagen supplementation may help, but it is unlikely as the structures actually lose their structural crimp and become more brittle. There is evidence that horses lose some control of muscle contraction, especially neck, which can contribute to stumbling. This may be exacerbated by proprioception and coordination deficits at the central nervous system level. It may not simply be a case of the horse being unfit or having bad feet, although these can contribute. Carrot stretches and similar physiology approaches can help tremendously here, as can obstacles or track systems that provide challenging proprioceptive terrain. Incidental exercise is created when the horse has to move to get food, water, or shelter. Common systems include paddock paradise, agriculture, or combos. Be aware that some horses find these systems stressful, especially initially, so introduce change slowly. This is particularly important for elder horses who have trouble adjusting to change and may have impaired mobility or eyesight. Pick your system carefully, introduce it slowly, and monitor to ensure the horse is not being bullied or cannot navigate a more complex system. Older horses cannot physically go as fast as their younger companions, but they do respond to conditioning work. Researchers have found improved cardiovascular and respiratory function with exercise within an 8-week program. Be gentle on your oldie. Regular is better than far. Horses were not thought to suffer many forms of cancer until quite recently. We now know cancer causes about 19% of all deaths in older horses and can be a variety of forms. Melanomas, unfortunately, will appear in grey horses, and approximately 2/3 of those melanomas that develop will be malignant. Cardiovascular disease is relatively common in older horses, but is actually only associated with around 5 to 8% of deaths. Sudden death from rupture of artery walls due to stiffening can occur in athletic horses, in older stallions during coitus, and in older mares giving birth. The detailed etiology of why these artery walls become stiff is still unknown. Heart murmurs will be found in up to 1 in 5 older horses and 1 in 3 very old horses. Heart murmurs occur when the valves of the heart are not sealing properly. This is due usually to past bacterial infections on the leaves of the valves. Valvular insufficiency is associated with sudden death and chronic congestive heart failure. Respiratory disease is the third most common disease seen by vets in geriatric patients after gut and musculoskeletal problems, but it is usually associated with only around 4% of deaths in elder horses. Coughing, nasal discharge, and abnormal respiratory sounds when asked to breathe are all signs of respiratory dysfunction. Although not often the cause of death, respiratory dysfunction does reduce the quality of life of horses. Laryngeal disease includes left laryngeal hemiplegia and other functional problems. But equine asthma is by far the most common cause of respiratory distress in older horses. Gastrointestinal disease causes around 42% of all elder horse deaths. Sadly, older horses are more likely to develop the colics that require surgical intervention in order to survive, and they are also more likely to suffer complications during colic surgery. This may be due to the type of colics they suffer, but also the comorbidities that they often present with, such as PPID and obesity. Cecal and large intestine impactions are common in older horses due to reduced intestinal motility, failing dentition, and again the decreased frequency of preventative dental care. Small intestine colics are more common in older horses, usually due to pedunculated lipoma strangulation. Older horses have more problems regulating their own body temperature. Some sweat more, and some feel the cold more, and some do both. Some breeds, such as thoroughbreds and Arabs, may need more diligent rugging. That said, you are doing more damage if you allow the horse to get hot, as it will lose valuable electrolytes in sweat. End-stage PPID is tricky, as the horses tend to be hairy and of light weight. I would get the rug off as much as possible, as long hair and a reduced immune system makes the horses more vulnerable to lice and fungal skin infections. I strongly urge you to talk to your veterinarian about management strategies here. Ironically, you might have to consider clipping, even if it is just a trace clip, and rugging to make the PPID horse more comfortable. This is one of the reasons why treatment is so important in these horses. I just want to spend a short period of time on talking about senses and cognitive function of older horses. Over 90% of horses older than 15 years of age have ocular changes in their eyes, even though the owners of these same horses had only detected 3.5% of these changes. The good news is the functional visual impairment of these horses is usually low. However, ocular lesions of any sort are painful and should be managed. Eye problems are very hard for owners to detect, so a thorough ophthalmological exam should form part of your annual veterinary exam of your older horse. Older horses do appear to suffer some hearing loss, so you should be aware of this when interacting with your horse. Unfortunately, the ability to experience pain is one of the few functions that does not seem to decrease with age. Please remember, horses are prey animals, so if they are showing pain, we can safely assume that the pain is more severe than it appears. Horses in pain will be more withdrawn and show avoidance behaviours to both you and the other herd mates. Watch your horse carefully and be aware how pain may be playing a role in how the horse is feeling. Pain can have a profound impact on cognitive function. It can make the horse seem less interested in the world, and it can also make it hard for the horse to lie down to sleep. So it becomes sleep deprived. This adds to the cognitive disengagement. Playing with your old horse gives you and the horse the opportunity to increase both your dopamine levels, and you may also get insight into how your horse is doing. Just putting them out in the paddock to live their life isn't really enough for a horse that has been around humans all their life. The decision to euthanize is an important part of managing your old horse's life. Euthanasia in a timely, pain-free and peaceful manner is the best death we can give our horses. It is the ultimate act of responsible horse ownership. It is a gut-wrenching and emotional decision, but one we should and must make. Owning an elder horse is a privilege. Please plan how you are going to manage the end of the life process in a way that is dignified, safe and peaceful for your horse. You will also need to consider the practicalities of disposing of the body. This is no mean feat these days, as knackeries will only take horses and horse carcasses under certain circumstances, and many councils will no longer allow horse burials on properties. Plan ahead, the day will come. So in summary, actively monitor your horse's body weight, top line, hair growth patterns by taking photos every few months to monitor. Look out for bullying from other horses. Keep your horse moving. Multifocal musculoskeletal disease, dental problems, and concurrent cardiac and respiratory disease are frequently found together in the aged horse. It takes a talented veterinarian and a dedicated owner to provide the necessary health care needed to manage elder horses, but it is very rewarding. All horses are individual and have individual needs. Elder horses are just more individual. They have specialist requirements. Care of the elder horse is both hard work, but so rewarding. Thank you for listening, and good luck in your elder horse care.